Well, another one of the wonderful Weezie's angels is Tommy Austin, and you have been a nurse for how long, you said?
31 years.
All right, we were just saying you basically seen it all.
Yes, pretty much.
And just when you thought you'd seen it all, this came along, right?
Here comes the pandemic.
Okay, compared to your other 30 years prior to this, how would this compare?
Well, the other events were short lived. So, Tropical Storm Allison, when I was at Memorial Hermann in Houston, we had to deal with that and evacuate over 600 patients. But that was short lived. I've never been in an event that lasted 6 months. And that's what's going on right now. And such a lifestyle change for everyone. But I think one of the biggest things is not having patients have visitors. To me, it has been one of the most um, saddest things about COVID-19 for me. Knowing people that are spending their last days alone, and not alone meaning the nurse is not there, the physician's not there, the chaplain's not there, but their family is not physically present to help them transition.
That must really, like you said, weigh hard on you.
It does. It does. And there are times when, we make exceptions for people. But, the majority of people, family members are afraid. So they might not come. But it does weigh heavy because, I was there for when my grandmother transitioned, when my mother and father transitioned. I was there present for that. And I know how sacred that is. And so to know someone is in their last hours and not having um, that comfort of hearing that voice of those that love you, to me is very devastating. And to me, that's one of the most devastating parts of COVID-19.
So, how did you all deal with that?
So how we dealt with it, we've used
Personally, how'd you deal with it?
we've used technology and other methods to help people communicate. Um, but it's been very difficult.
But I mean, as nurses, when you're not in the room with the patient, when you're all back there just together, how do you deal with that? Because again, that's feels like a
Well,
heavy.
we have to allow the nurses to debrief. We have a room where nurses can have downtime, and we have aromatherapy and massage. We have a massage chair in some of those rooms, but they have to be able to decompress. And so we have what we call a code lavender, where we go to the unit and make sure that the staff can talk about the incident, and that we provide them with emotional support. At university, we also have what we call an employee assistance program where they can get psychiatric help as well.
But also just having somebody there, a fellow nurse.
Yes, yes, and people, I think the nurses have bonded really well behind COVID-19 because we've had to be there for each other, to be that support, knowing that the family's not there. You have to be that rock for that patient.
Boy, that's a big responsibility.
It is a heavy lift, and I know now people appreciate nurses much more because you've seen nurses in media a lot more during the pandemic than I've ever seen. Um, but this is what nurses do every day. They take care of patients. They're there to comfort them, to care for them, to make them feel like humanized and individual. No matter what stage in life they are, homeless, president of the United States, it doesn't matter. The nurse is there to take care of you and to provide you that comfort and care during that time when you're most vulnerable, and that's when you're in the hospital.
And this is where the TLC that we always hear about nurses
Yes,
really comes
tender
in, right?
loving care. Yes, yes.
Well, obviously, you said without families being there, and that's one of the toughest things that you saw. What were the bright spots?
Well, the bright spots have been seeing other directors go to units where we had COVID patients, seeing other coworkers take food and items to those units to make sure they feel supported. We've had tons of people from the community through our foundation donate food and different other things for our nursing staff. children writing letters, strangers writing letters and sending, thank yous for taking care of patients. That has been so heartwarming and uplifting. And so, seeing some of those things happen, let you know that through this pandemic, there are bright spots. And I think people have taken the time to slow down. I didn't think people wrote letters anymore, but I've had one girl. I think she wrote like 30 letters and individualized them and drew on the letters. People just taking time to really show nurses and other caregivers, because we have respiratory therapists, we have pharmacists and technicians in the lab, of course. All of these disciplines have worked closely together to create an environment to take care of patients. And that's what's been important to me. And I've seen the teamwork through every department. And it has been so heartwarming to see that.
Basically, you're taking care of the patients, and sounds like the community is taking care of you.
Yeah, and that's what's been happening. We've gotten some really good food from the community. Tacos, tamales, Vietnamese food, Chinese food, American food from delis and different things. And so people have just been wonderful. They've been really, really wonderful.
What do you see in the near future?
Well, we have flu season coming up, and our worry is that people don't get the flu shot, and that you could actually have the flu and COVID-19 at the same time. And I would hate to see anyone have that, have both of those happening at the same time. So, just making sure that we don't become complacent in our hand hygiene and our social distancing, our physical distancing, and in our wearing of masks. And so just making sure that people adhere to that, and that, by opening our schools, that we've not created another group of vectors that can spread the virus. So those are my things that I look at toward the future. And of course, every holiday creates a little pull in my heart, because I know people want to get together, and I hope that togetherness doesn't mean that they become complacent and not follow the CDC guidelines for keeping safe during the pandemic.
Okay. Thank you so much. Thank you for all your work too. Appreciate that.
Thank you. Thank you for your time. I appreciate you.
And congratulations again.
Thank you. Take care. Bye-bye.
You too. Bye-bye.